Hi, my name is Jenny Brady, and I have been a nurse now at Primary Children's Hospital for over 7 years. I also have 3 children. I have a 7-year-old named Sean, a 4-year-old named Elizabeth, and an almost 2-year-old named Charlotte. When Sean was about 1 year old, my husband and I noticed that he was not meeting his developmental milestones as he should have. He didn't walk until almost 15 months, and he also didn't talk for the first 3 or 4 years of his life. We proceeded to have multiple testing done, had autism rolled out completely, and yet here at 7 years of age, we still do not have a diagnosis for him. I have learned how to become an advocate for my child. So many of my concerns fell on deaf ears, and I had to be the one to push to obtain diagnoses and interventions for my son. I've had to learn how to be an advocate when no one listened and brushed my fears aside. I've had to learn how to persist when there's that gut feeling of something being wrong. As a mother and as a nurse, I have learned how to advocate for not only my children but also my patients. I've made and continue to make a difference for my patients, their families, as well as my coworkers. Becoming a DNP would allow me to continue to make this difference for these patients, but with an expanded knowledge, my past experiences, as well as the latest evidence-based practice, I can make that difference for these families between good care and excellent care. A little over 4 years ago, I applied and was hand-selected over my peers to become a charge nurse advisor. I took on the responsibilities of overseeing education, training, helping initiate and usher in change, as well as overseeing a particular group of patient care techs. With these increased responsibilities, I also took on the role as becoming a charge nurse on the floor. While both charging and working on the floor, I am utilized frequently for my critical thinking skills, my ability to diffuse difficult and emotional situations, as well as helping solve immediate staffing issues and, most importantly, patient issues. I am very comfortable in this role and have enjoyed seeing the difference I have made. I am ready for more responsibility and the increased role of leadership a DNP degree brings. I am a leader. I am personable. I am accountable. I am respectful of my patients. I can relate. I can draw upon personal experiences and help my patients and their families feel at ease. With an ever-changing healthcare system, we need strong, adaptable leaders to usher in this change. I am one such leader, and I'm ready to take on this particular challenge. I know the medical field is ever-changing, and we are in need of quality, educated individuals to help usher in these changes. As a charge nurse, I see the shortage of nurses within our own community. I see the impact it brings not only to our patients, but to our staff as well. I've witnessed the burnout as well as felt it at times myself. Change is needed, and who better to help usher in this change but those who have the experience and hold the highest degree available within nursing practice. The demand for nurses, and particularly those with the DNP degree, is a growing field, and it will continue to grow. Every year, more training and schools are established to meet this demand. One particular characteristic of the DNP program is the requirement of the minimum of 1,000 clinical hours. The importance of clinical experience is what prepares us most to become licensed independent providers. Our clinical hours, our obtained knowledge, our past experiences, and our evolving care is what prepares us most to meet these challenges and to care for our patients. Another particularly important characteristic that sets apart a DNP from any other NP program is that of a DNP project. The project must be focused on something the student is passionate about, something that will bring change, something research focused, something I'm passionate about and feel can make a difference is that of our nurses. I am passionate about our fellow nurses. I've seen the pain of losing a patient. I've personally experienced that pain of losing a patient. I've seen and felt the burnout of being overworked and understaffed. I've seen the loss of many good nurses due to lack of support. I'd like for this to change. I want to make it possible for nurses to find support groups. I want nurses to have resources easily accessible and well advertised that are there to support them in times of need. This could be potentially possible via an app development. The app would have access to local counselors that an individual may see, support groups, tips and tricks for more mindfulness for the individual, meditation videos, access to workout tips, weekly group challenges, as well as humor to help lighten the mood. I want to help make that difference for our patients by helping retain our experienced nurses. Patient care and experiences can only improve through retention of good quality nurses. Just like I have had to learn to advocate for my son and his needs, our nurses need an advocate who understands their concerns, their needs, and can help be a voice for change. Ultimately, in helping our nurses, we can help change the outcomes for our patients. Thank you for your consideration for the DNP program.